Hello, and welcome back to our channel. Today, we're discussing a topic that affects many people, vertigo, and its connection to vitamin deficiency. If you've ever experienced dizziness, spinning sensations, or loss of balance, you might be surprised to learn that these symptoms could be related to a lack of a specific vitamin in your body. So let's discuss how certain vitamin deficiencies can play a role in causing vertigo. To begin, vertigo refers to a form of dizziness characterized by a sensation of spinning, either of oneself or of the surroundings, even in a state of complete stillness. This condition frequently arises due to problems within the inner ear, or the vestibular system, which is responsible for maintaining balance. One of the prevalent causes of vertigo linked to inner ear issues is benign positional paroxysmal vertigo (BPPV), often referred to as dislodged crystals. This ailment, affecting approximately 10% of the population, is associated with a feeling of instability. When the crystals in the inner ear move from their normal position, it can cause a feeling of spinning that usually lasts less than a minute. This spinning sensation is often brought about by turning to the right or left while in bed. Experts say that sometimes you might feel nauseous and throw up during this situation. This tends to happen more often in people who are older than 65 because the calcium carbonate crystals in the inner ear, which are often called crystals, break down as they age. Interestingly, vertigo is 3 times more frequent in menopausal women than in men. This gender disparity may be attributed to hormonal fluctuations during menopause, affecting the delicate balance within the inner ear. As these calcium carbonate crystals deteriorate, they can disrupt the standard signals sent to the brain about spatial orientation and movement. As a result, women going through menopause might suddenly feel dizzy and like things are spinning around them. This usually happens when they move their head in a simple way. This situation highlights how hormonal changes are closely tied to how our body responds, showing us that vertigo is a complex issue. Moving on, let's discuss the 2 distinct forms of this condition, which are peripheral and central vertigo. Peripheral vertigo occurs due to issues in the inner ear's balance-controlling part, referred to as the vestibular labyrinth or semicircular canals. Problems with the vestibular nerve that connects the inner ear and brainstem can also contribute to this type of ailment. The causes of peripheral vertigo are diverse and can include conditions like benign positional vertigo, medication side effects, injuries, inflammation of the vestibular nerve, inner ear swelling, Meniere's disease, or pressure from non-cancerous tumors such as meningiomas or schwannomas. On the other hand, central vertigo is rooted in brain dysfunction, commonly in the brainstem or cerebellum. Central vertigo may result from conditions such as blood vessel disease, specific drugs, multiple sclerosis, seizures, strokes, tumors, or even vestibular migraines, a subtype of migraine headaches. Note, the primary indication of vertigo is a feeling of movement or spinning, either of yourself or the surroundings, often accompanied by sensations of nausea and vomiting. Additional symptoms that might manifest depending on the underlying cause include difficulty focusing the eyes, dizziness, hearing loss in one or both ears, decreased balance leading to potential falls, tinnitus, and nausea and vomiting, which can result in fluid loss. In instances where vertigo originates from brain-related issues, central vertigo, there's a possibility of experiencing other symptoms like trouble swallowing, double vision, problems with eye movement, facial paralysis, slurred speech, and limb weakness. But did you know that a certain vitamin deficiency can also contribute to vertigo? Vitamin D, often called the sunshine vitamin, plays a crucial role in various bodily functions beyond bone health. Stay tuned too as we discuss the importance of taking this vitamin in preventing vertigo. Vitamin D is a fat-soluble vitamin primarily known for maintaining healthy bones and teeth. However, its functions extend far beyond skeletal health. It is involved in immune system modulation, cardiovascular health, cognitive function, and even regulation of gene expression. One of its lesser-known roles is its impact on the vestibular system, which maintains balance and spatial orientation. The vestibular system includes the inner ear and parts of the brain that handle signals related to balance and knowing where you are in space. If this system isn't working properly, it can cause dizziness. Surprisingly, there are vitamin D receptors in the inner ear, especially in the cells that help you stay balanced. These receptors play a vital role in managing calcium levels within these cells, thus impacting their optimal operation. However, it is important to note that inadequate this vitamin levels can result in calcium imbalance, disturbing the inner ear-brain communication. This disturbance can give rise to symptoms like vertigo and other problems related to balance. Several studies have investigated the potential link between vitamin D deficiency and vertigo. A study published in the Journal of Clinical Neuroscience found that individuals with benign paroxysmal positional vertigo, BPPV, were more likely to have lower vitamin D levels than the control group. Another study published in the Journal of Vestibular Research suggested that vitamin D supplementation might positively impact patients with vestibular disorders, improving their symptoms and overall quality of life. Additionally, recent research suggests that increasing your intake of both vitamin D and calcium could reduce the likelihood of experiencing a severe type of vertigo. The most natural way to obtain it is through direct exposure to sunlight. When your skin is exposed to UVB rays from the sun, it surely triggers vitamin D production in your body. Spending 10 to 30 minutes in the sun a few times a week, with face, arms, and legs exposed, can be sufficient for many people. However, skin tone, geographical location, time of day, and season can influence the amount of vitamin D produced. While relatively few foods naturally contain vitamin D, there are still options to consider. Certain types of fatty fish, such as salmon, mackerel, and trout, are excellent dietary sources of this wonderful nutrient. They provide a significant amount of the vitamin, along with healthy omega-3 fatty acids. Also, many foods, such as milk, orange juice, and breakfast cereals, are often fortified with vitamin D. Check the labels to ensure the products you consume contain it. In addition, egg yolks and mushrooms are a moderate source of vitamin D. Incorporating eggs into your diet can contribute to your daily intake. Likewise, some mushrooms like shiitake and maitake naturally contain it when exposed to sunlight during growth. To combat the deficiency that contributes to balance issues and vertigo, ensure you spend time outdoors to absorb natural sunlight, a primary source of vitamin D. Also, incorporate foods like fatty fish, fortified dairy products, and egg yolks into your diet. In cases where sunlight exposure or diet is limited due to some factors, vitamin D supplements can be a viable option. These supplements are available in two primary forms, vitamin D2 and vitamin D3. The latter is more effective at raising blood levels of vitamin D and is often recommended. It's essential to consult a healthcare professional before starting any supplementation regimen to determine the appropriate dosage. While obtaining vitamin D is crucial, it's essential to balance sun exposure with skin protection. Prolonged and unprotected exposure to the sun's UV rays can increase the risk of skin damage and skin cancer. One of the other well-known functions of vitamin D is its role in bone health. It aids in absorbing calcium and phosphorus from the intestines, vital minerals for maintaining strong and healthy bones. Without enough of this vitamin, your body struggles to absorb other minerals efficiently, potentially leading to bone diseases like osteoporosis, particularly in older individuals. Another critical aspect of vitamin D is its influence on the immune system. Research has shown that this vitamin modulates the immune response, potentially helping the body defend against infections and diseases. Vitamin D deficiency has increased susceptibility to infections, autoimmune disorders, and chronic diseases. Furthermore, emerging studies suggest that vitamin D might impact mood and mental health. Some research has linked its low levels with depression and seasonal affective disorder. While the exact mechanisms behind this connection are not yet fully understood, it highlights the broad effects this vitamin can have on the body. Additionally, studies indicate that sufficient levels of vitamin D might support cardiovascular health by helping to regulate blood pressure, reduce inflammation, and enhance overall heart function. Another research also suggests that it could potentially play a role in reducing the risk of certain types of cancers, such as breast, colon, and prostate cancers. Vitamin D also plays a role in insulin sensitivity and blood sugar regulation, potentially aiding in the management of diabetes. Research suggests that maintaining adequate levels of vitamin D could potentially improve the body's ability to utilize insulin, thereby helping to keep blood sugar levels stable. This connection highlights the importance of considering this unique nutrient as a potential factor in diabetes care. It underscores the need to explore further its role in supporting overall metabolic health. It's crucial to ensure that you incorporate calcium-rich foods into your diet to support this effort. Including foods naturally high in calcium, such as yogurt and cheese, as well as fortified plant-based alternatives, can contribute to your overall intake of this essential mineral. Additionally, leafy green vegetables like kale, collard greens, and broccoli are excellent natural sources of this crucial mineral. By consciously including these foods in your diet, you can promote overall inner ear health and potentially reduce the risk of experiencing vertigo episodes. Remember, a well-balanced diet that includes sufficient vitamin D along with calcium is crucial for supporting various bodily functions and maintaining optimal well-being. Now let's examine the suggested dosages of vitamin D and calcium that could potentially aid in preventing episodes of vertigo. It's crucial to emphasize that seeking advice from a healthcare expert before modifying your supplement regimen is of utmost importance. Starting with vitamin D, the optimal daily intake differs based on age and gender. Typically, adults should target a daily intake ranging from 600 to 800 international units. Nonetheless, if a deficiency is identified, your healthcare provider might advocate for higher doses over a defined time frame. Shifting to calcium, the recommended daily amount also varies. Generally, adults are encouraged to aim for approximately 1,000 to 1,300 milligrams daily. It's worth noting that diverse dietary sources such as dairy items, leafy greens, and fortified foods can contribute to your calcium intake. Moreover, did you know that vitamin B12 deficiency can also trigger vertigo-like symptoms? Insufficient levels of this crucial vitamin might result in various neurological issues. These could encompass sensations of imbalance, lowered blood pressure, and reduced blood circulation to the brain, as explained by Whitman. If you're experiencing episodes of dizziness, it's advisable to consult your doctor regarding a basic blood test to assess your B12 levels. Notable sources of vitamin B12 comprise meat, dairy items, and breakfast cereals fortified with the vitamin. Individuals following a vegetarian or vegan diet might value incorporating fortified cereals, plant-based milk, and B12 supplements. Magnesium deficiency has been linked to vertigo due to its role in maintaining inner ear health. Incorporate magnesium-rich foods like nuts, seeds, whole grains, and leafy greens into your diet. Potassium plays a crucial role in fluid balance within the inner ear, making it essential for preventing vertigo. Incorporate potassium-rich foods like bananas, oranges, potatoes, and spinach into your diet. Be cautious with potassium supplements, which can interact with medications and disrupt heart rhythm. Lifestyle modifications can also contribute significantly to vertigo prevention. Stay hydrated to maintain proper fluid balance in the body and inner ear. Engage in regular physical activity to enhance overall circulation and balance. Practice stress reduction techniques like yoga, meditation, or deep breathing, as stress can exacerbate vertigo symptoms. So there you have it, the vitamin that might help prevent vertigo episodes. Remember, everyone's body is different, so it's essential to work closely with a healthcare provider to find the right approach for you. If you found this information helpful, give us a thumbs up, and don't forget to subscribe for more health-related content. Thanks for watching, and take care of yourselves.